I'm Todd Neal of MedPage Today. This week, researchers reported the results of a Phase 3 trial of the investigational weight loss drug lorcaserin. Here to discuss how the drug might fit into the treatment of obesity is Dr. Michael Jensen, an endocrinologist at the Mayo Clinic in Rochester, Minnesota. Thanks for joining us, Dr. Jensen.
Thanks for having me.
Now, after 1 year, patients taking lorcaserin lost about 13 pounds, and those taking placebo lost about 5 pounds. A greater percentage of patients on lorcaserin maintain the weight loss at 2 years. So how does this compare with currently approved weight loss drugs?
It's roughly the same as what we have available now.
How did the safety look with lorcaserin?
The safety was acceptable. There weren't any of the problems with heart valve disease that was associated with the predecessors of this compound. Didn't have some of the GI side effects that one of our currently available drugs has, and it didn't have some of the cardiovascular side effects that the other one has.
And so, if approved, how would lorcaserin add to the armamentarium of weight loss drugs?
Well, not everybody responds to the medications we have available. In fact, the bad thing as a physician, most patients don't get the kind of response they want, and we're not really sure why. So having another option for people who don't respond to one of the medications is helpful, just as in when we treat blood pressure or diabetes. If you don't respond to one compound, it's nice to have a backup.
Okay, so this wouldn't necessarily be a clear advantage over the other medications. It would just be another choice.
That's the way it looks right now.
Okay. And so just one more question for you, Dr. Jensen, and this one's a little bit more general. Can Americans medicate themselves out of the obesity epidemic?
We'd have to have a lot more money in the system than is really possible. There's just too many patients with weight problems to be treating every single patient with a drug. I think this is going to be a public health issue, and we need to address it as a public health issue.
Okay, and so it would be so medications alone would not necessarily be enough to bring obesity prevalence down. The behavioral modifications, lifestyle modifications would be necessary?
That and probably some, once we have a better understanding of the kinds of environmental things that are driving the obesity problem, is to take steps to improve our environment. So it's less of a willpower issue and more of good choices available to us.
Okay. Well, Dr. Jensen, thank you very much for taking time for us today.
You're welcome.
For MedPage Today, I'm Todd Neal.